the blockage of the arteries and so forth, why it's blocked.
Well, I mean, the plaque, like I said earlier, it's a plaque, cholesterol plaque that will be deposited within those arteries. Many factors interfere with that. Genetic factors, diabetes, high blood pressure, cholesterol, triglycerides.
So how can it be fixed medically, surgically?
Well, the real fix is really to minimize the size of the plaque. And the way to do that is by reducing your cholesterol and triglycerides, mostly cholesterol, LDL cholesterol. And they are very powerful drugs that we prescribe now for that purpose.
So not necessarily surgically.
No, I
It
mean,
depends on how.
the surgery, whether it's bypass surgery or stent or angioplasty, those are ways to unblock what's already been blocked to a severe degree. But they don't reverse the process. You're just rerouting the blood. You're creating new channels for the blood. But those new channels can get blocked again the same way the original channels became blocked.
High cholesterol, as we did talk about high cholesterol, and I'm sure with medication it can be reduced. So
That's correct.
So that's
I
very
mean, that's why
positive.
now we recognize that 80% of cholesterol is not from diet; it's genetic from the liver, and that's why oftentimes when we see somebody with a strong family history, our threshold to put on medication is low.
What about the relationship with menopause? The heart failure,
It's
heart diseases
well
maybe?
known for many years that women after menopause have increased risk of heart disease because it appears to be that the estrogen before menopause has some protective value for women. This, however, protection has been diminishing now with women smoking more, and that's why we're seeing even women before menopause with heart disease.
How about smoking and pregnancy? Do we has been any researches done on pregnant women, and does it affect the fetus actually?
I mean, there are many studies done on that. From a heart perspective, there are really not a lot that is being done, but there are definitely many aspects of harm that could be done to the fetus by the smoking mothers.
Again, we are with Dr. Asim Farhat, and I do have Roy on line one. Roy, good evening.
Hello, Dr. Seyam.
How are you, sir?
Fine, fine. To your guest here, I'd like to, if it's all right, in a proper way, informing that new studies came out yesterday that eating a healthy diet does not necessarily say you're not going to have a heart disease, a fatty diet. They gave a wide study, and it's too wide to ignore. So they say it has no correlation to heart disease. And one more, but I can't remember the name of it. I tried to sit here and remember, but I can't. But chicken and vegetables is what they were recommending, and no fats. It does not do anything to keep you from getting heart disease. Are you aware of that?
Yes, I'm aware what you're talking about. Basically, the study you're talking about was looking at low-fat diet and its effect on the incidence of heart attacks. And this was just released a couple days ago. And they were following, actually, I think it were mostly women in that study, and they were following for 7 or 8 years and trying to have them to take like 20 to 25% of their diet from fats as opposed to higher. I think the controlled group was like 33%. The other group, they were women who were let eat whatever they wanted to eat. So when they looked at how much fat as a percentage of the total diet, it was supposed to be 20 to 25% in that control group, in that treatment group, as opposed to the control group of 33%. And that study, again, did not show any difference in incidence of heart disease.
But that's just a sample. I mean, they take a sample of a population.
It's a large sample. It was a large sample and was followed for a number of years. There were a lot of critics, of that study. For instance, they say that the total number of calories was not accounted for. So when you say, well, I'm taking only 20% or 25% of the 3,000 calories, that's a lot of fat and a lot of cholesterol, as opposed to 20% of 1,500 calorie diet. So the total amount was not accounted for. On the other hand, people also criticized that the study was not well managed in terms of the data, because many of those patients went above the original design of the study. So there were some problems with the study. On the other hand, I totally agree with the caller that this is not the only factor, and I think it's wrong to think that you can go on low-fat, low-cholesterol diet and eat as many calories as you want, because we know now that a lot of the carbs turn into triglycerides, which also are harmful, even without eating any fat or cholesterol. So this is only part of the problem, is not really the whole problem. There are many other factors that lead to heart disease.
And you also mentioned that healthy foods cost more. Chicken, breast chicken, is on sale. As low as on the west side of town, 2 days before they announced this, was 79 cents a pound. On the east side of town, it's 99 cents a pound. So a lot of things that they do in these studies affect the cost of what foods and health foods run for. So do I blame the person who grew the chicken or the farmer or what? No, I think everybody is promoting this, and it just rises up the price of healthy foods, and poor people can't afford it. One more thing, doctor.
Go ahead, Roy.
I found one thing more interesting in your profession. We have the very best hospitals in the world. We have the best medical facilities, the best care, the best, the best of everything in the medical field. But when I received the prescription to go to the pharmacy, I had to pay $359 for my medicine.
Wow.
And I walked out and I said, well, we have the best of everything, but it sure is an unjust system. Is that a fair analysis, that it is unjust to charge people this outrageous price and nobody's saying anything about it? One guy, my neighbor across the street, broke his toe. A toe cost him $7,000. He hadn't paid, and he didn't understand the importance in paying his bill, or he would have been screaming. An unjust system we have is the best system in the world, but it's so unjust. Third world countries cannot get medicine.
Okay, Roy, we got it. So
Okay.
it's a quality versus a price. We're talking about quality and price here. It's kind of expensive.
Yeah, I mean,